stuck? Are you broke? If so, why? Why haven't you made any changes to live the life you want? It all comes from your daily habits, your routines, your thoughts, your actions. What's cool is that all of this can be changed quicker and easier than you think. Follow the steps mapped out in the habit formula and start to change your life today. Go to thehabitformula.com for more information.
Hey everybody, you know what time it is. It's lunchtime with the Habit Master. I'm your host, Dr. Stephanie Aldrich, and I help people get rid of their bad habits. A bad habit we're going to talk about today on Tooth Tuesday, right? All the way up my alley, is about your binky and the thumb sucking. It's a terrible habit to have. It's a terrible habit to have to deal with, and especially on my side of the spectrum when it's our responsibility to try to fix these kids' mouths after they've sucked these thumbs and had the binky until they're 18 years old, right? So we're going to talk about it. We're going to talk about four ways that, you can get that thumb out of your kid's mouth. And we're going to talk about the damage that it can do. So today is Tooth Tuesday. We always talk about dentistry and your mouth and all kinds of topics that is near and dear to my heart, being a general dentist. Before we get started, remember, if you want to learn how to tackle all the bad habits, there is a way to do it, and it's in the Habit Formula. Go to thehabitformulabook.com and grab your free copy. If you really want to dive into this material, you can upgrade your order. And I just want to remind everybody, prices go up on Friday. So try to get one of your orders. There's two types of packages. There's one that's just the audio book and 7 video mini course. And there's another one, and it comes with a workbook. And the other one is full go. You'll learn all kinds of stuff, okay? It's, I think it's 10 videos with some bonuses in there. The audio book, the ebook, the workbook, all of it. So it really helps lead you, into the process of being aware of your bad habits and seeing how if you tweak them a little bit, it'll get you different results than what you're getting now. So I'm reading directly from Nothing But the Tooth, 11 questions you should ask your dentist. If you want a copy of this, okay, just to help, let's say, somebody in your family has a binky or is a big thumb sucker. There's a chapter, it's chapter 7, that goes into this, and we'll be reading a little bit from there. You can go to akrondentalconcepts.com and grab your free copy too, okay? So we're talking about binkies and thumb sucking today. Pacifiers are a $15 million a year industry. Pacifiers were first cited in literature around the year 1473 in Germany. Basically what they do is they help the child comfort themselves. It's a suckling kind of thing, okay? What people find that is if they give their child a pacifier and they're trying to breastfeed, that they really have a hard time latching on to the nipple of the breast to try to get milk out. So a lot of times the pediatricians will say, hey, try not to, put a pacifier in at least for the first month until breastfeeding is, easy and is learned and you're doing well with it. So something to think about. Now, the good part about, a binky is that, it helps your child to sleep a little bit, to be comfortable, to feel safe, right? I know my kid, we did it about 2 weeks, and then after that he didn't want it anymore. And you know what? Being a dentist, I did not push it because I know what the ramifications are, the problems are with prolonged binky use. Now, another good thing about binkies is you could get rid of them. They're just a piece of plastic, right? Or a piece of rubber, right? That's it. A thumb, on the other hand, unfortunately, it's attached, right? So that issue, if your kid goes from a pacifier to the thumb, or maybe just goes directly to the thumb, it's definitely an issue that you got to tackle early, and you got to be persistent in it, because if they're walking around, they're 5, and they're still sucking their thumb, it's going to cause issues that cannot be corrected with surgery or with any kind of braces work. So we're going to get into that in a couple minutes, but we're going to read a little bit from chapter 7 about the thumb sucking. A pacifier can certainly help with promoting this natural instinct of suckling, and can help put your baby in a relaxed state, which usually means that you as the mommy or daddy can have some relaxation too, right? When your kid's sleeping, it's like, okay, we can get some stuff done and then we can actually sit down and relax too. But when your child is 3 and is demanding something to eat and is walking around singing and dancing and sucking on a pacifier, which I've seen happen in my office and also family members, this is when the problem starts. My own family members laughed and scoffed at me when I told them I didn't want my child to have a binky. I actually caved in for when he was first born, and he used a pacifier for a couple weeks. And then he didn't want it anymore, and I didn't back down and return it to him. Okay? To this day, I still have family members and friends having problems with their children's teeth being all messed up, and they're walking around with binkies in their mouths. Needless to say, I know a little bit more on the subject than they do. But I digress. In the January-February 2007 issue of General Dentistry from the Academy of General Dentistry, they had a study that says prolonged pacifier use and thumb sucking can cause problems with the proper growth of the mouth, alignment of the teeth, and changes in the shape of the roof of the mouth. During orthodontic movement of the teeth, a safe amount of force to put on the teeth without damaging the roots or surrounding bone is only 2 ounces, or the weight of 2 pieces of bread. Okay? So that's not a lot of movement. When your child is chewing on a pacifier, a 2009 study from the University of Leeds said that they studied the bite strengths of 200 children and found that some of the children had a bite strength similar to that of a dog, which is 235 pounds of pressure. You only need 2 ounces to actually move a tooth. They're exerting 235 to 328 pounds of pressure. Not ounces, pounds of pressure, similar to a dog bite. So what do you think's going to happen? And I drew this on there. So this is the roof of the mouth, okay? So if I was standing like that, that's what you're seeing, right? So the teeth are like this, right? The normal shape of people, of their mouth, of the arch, of the upper, is U-shaped, okay? When they're either thumb sucking or binky sucking for a prolonged period of time, and we're talking about the age of 2, the age of 3, the age of 4, okay? We're talking toddler ages. They already have teeth. We're not talking about a little newborn, okay? We're not talking about a little toddler or a little infant that's not walking yet. That's maybe just cutting teeth, okay? We're talking about a kid that's having tantrums and maybe is potty trained already, right? There's so much force going on that it actually protrudes and shrinks the width of it and makes it into a V. So they're pulling that forward, okay, into a V shape. Most of the time when you're biting sideways, right, this is sideways, these people have what's called an open bite, okay? So they forced things so much forward that the upper teeth are like this, the lower teeth are like this, but they're biting. You say, well, they're still open in the front. It's called an open bite. You've completely ruined your child's teeth. There is absolutely nothing. You could try a little bit of surgery, braces. Most of the time it'll correct it a little bit, but they're still going to have that weird looking, remember Tootie from Different Strokes and Facts of Life? she had an open bite, and she still has a little bit of an open bite if you see her as an adult, because she sucked her thumb. Or she might have had a binky or both. But I know she at least sucked her thumb. She has an open bite. There is nothing you can do to correct this issue. You have to get that thumb and that binky out of their mouths, okay? We're not talking about a newborn. We're not talking about a child that is just starting to teeth, 6 to 7 months old, okay? Up to maybe a year. After that, you need to get rid of that, okay? Now, an easy thing about a binky is you can just get rid of it. You can throw it away, okay? Unfortunately, these two things are attached, and you can't get rid of that. So we're going to come up with 4 different tactics to use to help with the thumb sucking, okay? A binky, what you can start doing is putting a little hole, just cut a little hole. You can jab it with a little needle, or you can cut a little edge, with some scissors. The kid likes that motion, that suckling suction, right? If there's a hole in it, they're not going to get that anymore. And a lot of times the kid doesn't want it anymore because, it's not doing what it's supposed to do for them, right? It's not soothing them. It's not creating any type of suction in there. So a lot of times they don't want it anymore. Okay, easy. Throw it out. Those things are disgusting. You know how many times it's been on the ground. They lose it. It's been stuffed in some diaper bag or whatever. You don't know how many germs are on that pacifier. Get rid of them. They are disgusting. Okay? And they also can cause your kid's palate to look like this and to look like that, which just makes so many problems for the poor orthodontist later in life. They may even have to have surgery to widen the palate, or one of those expanders that you have to press a key in and it cranks the palate out. Why? Because you didn't do your job as a parent. I know you got to sleep at night. I know your kid's fussing and whining, but guess what? They're only going to fuss and whine for a little bit. They have short attention spans. Control the situation and get rid of that crap, okay? Now, thumb sucking is a whole other issue. Why? Because we're attached, right? I can't just throw away somebody's thumb. But they can get infections in their thumb. Think of how disgusting the thumb usually looks. The nail can be damaged permanently because, it could have an infection or some kind of fungal infection or something like that. It can damage the nail bed. You can also get little calluses around the knuckles, all from the moisture and from the friction of sucking on that thumb, okay? We're not talking about infants here. We're talking about toddlers that have an opinion, that can talk and walk and tell you that I want some food and is potty trained. Once they have a full set of teeth by the age of 2, the thumb and the binky need to go bye-bye. Okay? It's not cute. If they're walking around and they're, taking it in, taking it out, there's an issue there. Okay? And we need to get rid of that issue as soon as possible, or you will be paying for a lot of orthodontic work, and the likelihood of them, being right, having the jaws line up correctly, having the teeth look good, are pretty low. We can only do so much in medicine. So realize that the sooner you get rid of the binky, and definitely the thumb, the better everybody will be, because I don't know if things can be fixed 100%. They definitely can be improved, but they're never going to be back to normal because your kid has permanently damaged their body, okay? So we're going to talk about 4 ways to get rid of the thumb habit. So we already talked about the binky. It's easy. You can throw it away, put a little hole in it, get rid of it, okay? Be the parent, be in control, right? So the first way to get rid of the thumb, and there's tons of books on this out there. Just look up Amazon. I had one that was a good thumb sucking book, and I couldn't find it today. But anyway, there's tons of them on Amazon, so just go on there about thumb sucking. There's stories, and there's more clinical kind of things. Do whatever you can do. Try different things until it works, right? So the first thing is a sock. You can put a sock over your child's hand and then tie a little ribbon around the wrist. And what it does is, yeah, they'll be able to stick out their thumb a little bit, but they're not going to be able to get it in enough, especially if it's a tighter sock. It's not daddy's sock, it's maybe their sock, right? It's going to be too tight, and it's going to keep their hand like this. It's not going to be able to go out, and they're not going to be able to shove it in their mouth, okay? I've told hundreds of patients this when they've had problems with their kids. The sock method really does work. You think it's dumb, but it really does prevent them from sticking that thumb in their mouth. It's too much of a struggle, and it doesn't feel right to them, even if they get the sock all juicy, right? They're trying to use it. And eventually they just stop doing it because it's not, beneficial to them. The second one is you can actually get nail polish for kids that bite their nails. We got some for my son when he was, I don't know if he was 4 or 5, but he kept chewing on his fingernails. And I'm like, that's not good because they were starting to bleed. It was really getting into the nail bed. And I'm like, you're not ruining your stupid nails because you've got a nervous habit. I don't know what his issue was at the time, but on Amazon we got this nail polish and it was really, really bitter. I don't know what it had in it, but it completely stopped him. You can also do the same thing on the knuckle of the thumb. You can do a little bit of the nail bed and a little bit of the knuckle. And I'm telling you what, that stuff is so sour and bitter. That kid will not want that stuff in its mouth. Okay, so that's an easy one. Another thing you can do that kind of goes along with nail polish is some kind of pepper. Some people have put hot sauce on their kid's thumb. That I would say isn't as good as the nail polish because if they have been sucking their thumb, the tissue's going to be, kind of mushy. It's going to be a little broken up. It's going to be damaged. The hot sauce can actually burn their poor thumb. So, you could try a little cayenne pepper or something like that. But, if their thumb actually has damaged skin, the pepper stuff might be a little not so good for their skin. It might burn them, okay? But that is a way. You can try it, okay? And the last thing that you can do is a reward system. Think back to when you were potty training them, right? How did you do it? Okay, a lot of times you'd give them an M&M or, they get to see their favorite story or movie or cartoon or something like that. Maybe they want a doll. Maybe they want a night with Grammy. You could say, if I don't catch you for the next few days, make it small. They're just little kids. But, for the next 3 days, you can have this, or you can go here, or you can watch this. Have some kind of reward system. I can guarantee at so-and-so of a point as you're doing things that they're going to be more interested in the reward than they are in their thumb. Okay? So remember, Binkies, easy to get rid of. You just throw them away. Be the adult. Get rid of them. They're going to whine a little bit about it. Just say, I don't know where it went. Like, don't throw it away in front of them, right? You're going to, when they go to bed, you just clear out the house. Get rid of them and just say, I don't know. Maybe Santa Claus took them or the pumpkin took them or, whatever, okay? Maybe the dog took it and ate it, right? Who knows? Who cares? Be the adult and get rid of those stupid Binkies. I'm not talking about a newborn or an infant. That's okay to have those. It's not going to damage the palate. If it does a little bit, it's okay. It will gradually, go where it's supposed to go, right? But I'm talking about the 4-year-olds, the 3-year-olds, the 2-year-olds that are walking around with a Binky and they're taking it out, telling you that they want something to eat, putting it back in, stomping around the house, whatever. Those children are way too old to have a Binky. They have a full set of teeth by 24 months. So a 2-year-old has a full set of teeth. By that time, they need to get rid of that Binky. Now, I realize that thumb sucking is a whole other issue because you can't, everything's attached, right? You can't just throw away their thumbs, okay? But try these 4 things. So trying to get rid of thumb sucking, you can do the sock method, where you have a sock that's a little bit tighter, right? Maybe one of their socks, or maybe a female sock, okay? That's a little bit smaller. You don't want a big sweat sock from dad that's, real wide and bulky, because they can still kind of manage to get their thumb out and then suck on it that way. You want something that's going to hold them in a mitten kind of thing. You can even try a mitten if you want, but, just put it on backwards so that they don't actually have their thumb exposed, right? You want to keep it like this, and then tie a little ribbon or little shoestring or something around the sock to keep it on. The sock, I think, is one of the most effective ways to stop them sucking their thumb. Usually within a week or 2, they're not doing it anymore, okay? The second way is nail polish. They have that bitter stuff for people that chew their nails. You can put it on the nail, and you can also put it a little bit on the first knuckle, and that usually, it's so bitter, they don't tend to, want to put that in their mouth anymore, okay? You can use some kind of pepper, hot sauce, something like that. But just realize, if the skin on their thumb is damaged, it might burn them. So that might be the least favorable way. And the last way for thumb suckers to stop is a reward system. Remember when you, potty train these guys, maybe they get a little treat after 3 days of not sucking their thumb. Maybe they get to watch their favorite movie or favorite cartoon, or spend time with Grammy, or have a friend over for a play date, right? Because at this time, they're starting to make friends because you waited too long, right? This subject is so near and dear to me. I can't tell you how many patients I've seen. I've had family members that are having issues now with their own kids and not being able to fix it all with braces. Modern orthodontics can only do so much. Even with surgery, a lot of times you cannot fix the palate and the growth pattern that the binkies and the thumbs have caused. They're terrible. When your child's an infant, they're not even teething yet, or maybe they're just teething, but they don't have, they can't walk yet. This is perfectly fine. It's a soothing kind of thing. It's a suckling kind of thing. It's okay. However, you've got a child or a grandchild that is walking, that has, is past 2 years of age, has all of their teeth. You need to get the binky and the thumb out of their mouth. Get some food in there. They need to be able to soothe themselves in another way. Get a blankie, get a favorite stuffed animal. Those things don't matter, right? And you can wash them a lot easier. Binkies are disgusting and dirty, okay? And their thumbs, you can really mess up their thumb, their nail bed, and the skin on their knuckle if you don't get that moisture and all that bacteria that's normally in our mouths away from that thumb area. The skin's already damaged, the nail bed's already damaged, and now you're putting that bacteria and who knows whatever else. And just think of all the stuff that they're touching all the time. And if that skin is damaged from it being moist all the time, you don't know what kind of infection they're going to have. So I hope this tells you how much I hate binkies and thumb sucking. I hope this helps everybody. Make sure you try any of these ways to keep the thumb out of the mouth. And I know at least the sock method will work. If you want to try the other 3, those will work too. So that's it for me today. It's kind of a shorter day. There's not much to say about that other than I hate it. Okay? If you want to not ruin your kid's mouth or your grandkid's mouth, don't give them a binky, and definitely make them aware of their thumb sucking. You want to get rid of it. You want to get that out of their mouth. Okay? Remember that you can find Lunchtime with the Habit Master shows and other episodes, other videos that I create on the 3 pillars of success: mindset, planning, and action, on my YouTube channel. It's the Habit Master YouTube channel. Go there today and subscribe and look at all the videos. You can also go on iTunes and Spotify and catch Lunchtime with the Habit Master shows if you don't have time to watch them on Facebook Live and you want to listen to them in the car. Because every day we go over a different subject. So you can always learn different types of habits that maybe you can start incorporating to get the results that you want. So that's it for me today. I hope everybody builds good habits together, and I'll see you guys tomorrow for Business Wednesday. I'll see you soon.